Live.
Senate Appropriations, January 27th, going through the first top 3 favorite agencies. So we now have Human Resources. So I'll let you introduce yourself, Commissioner.
Good afternoon. I'm Beth Pastici. I'm the Human Resources Commissioner. I've been in this role for about 9 years, and we've got the Agency of Administration, great financial team over here to support me today. So happy to have them here. I was going to go through our budget book, which you guys should have in your notes, and we'll walk you through the whole stuff. But you know, kind of the important pages, and we can zip around, and please feel free to interrupt me and ask questions whenever you like. But I would say starting on page 4 is the outline of human resources and our core to guidance. So our vision is a professional human resources team providing continuous and superior service to our most important asset, which is people. We partner with agencies and departments to create and retain an engaged, motivated, and inclusive workforce. Our pillars are breaking down silos, building people up, maintaining organizational effectiveness, building an inclusive and engaged workforce. And then we have a list of good guiding principles that our team works from. Page 5 is the breakdown of our budget and our big the big things that are happening. But we are mostly funded through internal service funds. We bill other departments back for the services that we provide to them with 10% general fund, and then 1%, about 6% internal service fund transfers. I said 10%, sorry, general fund, and then 1% we have a special fund. We're proposing a 5% budget increase for the fiscal year 27, and 80% of that is due to the increased salary and benefits cost, and the rest is a variety of operational expenses. We have 7 exempt staff and 105 classified positions. We're continuing the focus this year on our classification system modernization project. If you recall, last year, you gave us funds to get started in this project. We had already bid that project out. So as soon as the funding became available on July 1st, we started engaging with this vendor, and we're well into that project. The first phase of that is will be just fully looking at how we're going to change the system that we've had in place for 4 years. So that work is well underway with our vendor and our classification compensation team. We've also engaged folks across state government and other branches in the initial conversations with the vendor, so they understand what issues are. And now we're just working through and starting with kind of the detailed work.
Yeah, so we give you more than 1 year of funding.
It was funding, one-time funding, but the project it started this fiscal year, but it will go into next fiscal year. We won't spend all the money this year.
Well, you need more money to finish the project?
We are not asking for any more money at this time. I don't think that, when it comes to the end, so it's a classification and compensation system, the compensation piece, depending on what the vendor recommends, and then what the administration takes from there. And potentially, if we're in a place where we want to negotiate something with our labor partners, at that point, there could be an additional funding request, but that's too soon for that.
Okay.
We really are in the classification piece of that.
Or will all the times reclassifications be done, or they'll just give a recommendation on how to do the work, and then we have to actually.
It's kind of 2 separate pieces. So the idea is changing from that Willis point factor system and actually breaking down to job architecture and job families, and looking across vertically within the department and across departments on how jobs compare to each other as well as vertically. And that's about all I can say about it for now, but we can definitely come in and talk more about that project if you guys are interested, or operations.
And does it put us more in line with other states?
Yeah, we are. we are very, very behind other states in what they've been doing. Our, as I said, our system is implemented in the 80s, and that point factor type system really aren't being used anymore.
Right.
We're not considered the modern way of,
Right. When Senator Kitchell was here, she talked about it. So
Yeah.
Some of that was started when she's first started
Yeah.
working for state government. And is it only for classified, or is it for the exempt and the appointees? And
As for
everybody?
the classification system is for classified employees. Yep.
And
We
what
have
that-
separate pay plans for exempt employees. So we have an exempt attorney plan that won't, the work can spill over into there, but the first phase is really looking at that lowest point factor system and coming up with something new.
Thank you.
And then continued focus on our enterprise resource planning system program. So you may have heard that as the Workday project, but that is changing out the VTHR system, as well as the vision system, as well as the budgeting system, to have one common system across state government. It's a multi-year project. I'm going to say we're first, but we're kind of second, because we are already did the budgeting or portions of the budgeting system, but our work is like a lot more involved because we have so much to do and so many changes to make. So we're well into that. We've been well into that for a year. Running through our department, I have in the presentation, starting on page 6, the different divisions and what they do individually. But if I could just turn you guys to page 13, it's kind of a nice pictogram of the various divisions and just one or two measurements from those systems to kind of illustrate what they do. So we have our classification division, and they review the job classes in 2025, 392 job classes reviewed, which was 70% of all of our job classes, and it impacted 1,330 employees. We provide the benefits for state employees. So medical plan premium rates, this year they increased 9%, at 5-year average, 11.4% increase. So this is the first year in a few years that we're below 10%, which is progress, but still way more than we're seeing, pre-pandemic and then the years.
That's for this year.
That's for
4%.
right,
26.
2020
5-year.
calendar year 2026. We
Yeah.
have a 9% increase.
Yeah, because VHI was 7.2%.
And then
So that's a driver, probably.
it's a driver across state government. Okay, the employees pay 20% of the premium, and the employer pays 80% of the premium. So that's reflected in all the departments' budgets.
That made it hard for folks that are mostly personnel to stay within the governor's 3%.
Yes. And then we do payroll, so we processed 257,286 paychecks last year. We do employment misconduct investigations. We have a target of completing those within 80 days or less, and that's an internal target. And in fiscal year 25, we did 80% of those in 80 days.
And does your department try to work on things like thinking about the cost of healthcare, or you just get the number and figure out?
Oh, no, we
Yeah.
absolutely look at the cost. We look at the cost of healthcare for our employees, some of the things that drive the healthcare and are driving increased costs. And what we see in our plan is the same drivers that we're seeing across the US, and the high rates of increase that we're seeing within the state of Vermont in particular are being reflected in our plans. One of the drivers, in addition to hospital costs, are the GLP-1 drugs, which are the weight loss medications, are and using those that were previously diabetes medication. Those more widespread of use of those for weight loss has been a cost driver as well. And we do, in partnership with our labor partners, we have a benefits advisory committee, so we meet quarterly and we discuss, cost drivers and metrics also with.
Our wellness program, is that?
In our benefit
HR.
and wellness division, yes, we have our wellness program. One of the things that you may see at the State House, they come and do biometric screening. So you may see our wellness team there. They also do, while you're out of session, they do flu shot and COVID shot clinics. And they have a whole wellness incentive program, and you can get points and potentially if you get enough points in the quarter, you can get kind of a credit towards your healthcare. It's not enormous, but it's fun. I think it's great to be, you can track all the things that you're doing every day and say, hey, I ate my vegetables today. I get to check the box, and it's just kind of motivates you to stay healthy or get healthier. So
I assume that's an effort to lower healthcare as well.
Yeah.
Maybe more.
that's all part of the way we do that program is it's actually a piece of our health insurance. When we bid for our health insurance, we're self-insured, but Blue Cross Blue Shield is our vendor, and they do the administration. They set aside money for us to use for this wellness program. And the point of that is actually to reduce our healthcare costs.
It's not the PATH program, I'm just thinking about like the benefits that we have as teachers.
Yeah,
Is it similar?
it's probably very similar.
Okay.
I'm not familiar with that.
Okay.
But it's,
Fair.
it's probably very similar. Yeah.
Okay.
We have a workforce development division, and they run the training center called CAPS, which is up at the old Vermont College campus. And one of the programs we offer is called Supervising in State Government, and all first-time supervisors are required to take that program. And the statistic here is just 83% of those who took the program felt that they were better off and better supported and better prepared to be supervisors as a result of this program. And this goes to the wellness. This is the 66% of state employees participated in the wellness incentive program, so had some interaction with our wellness team. We have a reporting team that pulls a lot of statistics out of our employee data, and they did 781 individual queries in the past year. But one of these see as a result of the ability for us to report on our employees is our annual, what's it called, our workforce report, our annual workforce report, which I think many of you are familiar with, and that has a lot of statistics about state employees. And I have that with me if you.
We've been talking about it in transportation.
Yeah.
In the talent acquisition, that number 1,851, is that over the year, or is that a time?
That's
Moment in time, there was that many openings.
over fiscal year, there were 1,851 job openings. I actually pulled from our website now. We do have a recruitment and vacancy dashboard that you can link to from our website. And currently we have 886 vacancies, and let's see, just see how many current job listings that's on there. We have I have requisitions on this dashboard, which is different than a job posting because that includes like pre-posting and
You
post-posting.
could have a vacancy, but you're not trying to fill it.
Yeah. Or it's just not, the job's not posted because we're getting ready to post or we're interviewing and we haven't made this selection yet, but we have.
800 openings, is that compared?
The 86 is our vacancy rate, our vacancy number of vacancies.
Right.
And 469 of those, I would say we're actively recruiting or in some stage of that recruitment process.
Do you know how that compares to like over a 5-year trend, or that about where we at?
We do have that in the report. We have our turnover, we had a high spike, and I'm not thinking, and I don't know if it was 2022 or 2023, but since then we've been down. I think this is the second or third year more in a normal trend. So we're back at around, our turnover this year was right around 12%, isn't it 12%? and it was up a little bit from 2024. The turnover rate is primarily driven by voluntary turnover. Then second by retirements. Over the past couple of years, retirements have been actually very low, and we're seeing that spike up more of an increase this year. So we're expecting by the end of fiscal year 26 to be above that the past several years in retirements. So it
Returned to work and do it.
could have, you know, everyone makes their own decision about when they're going to retire. And yeah, I mean, Harold Schwartz, I don't know if you know Harold Schwartz, but he's been coming with me in the budget since I've been in DHR, and he retired in December, and he'd been planning on retiring for a year. So yeah.
You haven't seen turnover effect from return from officers, what I saw in the news that there wasn't a big impact.
It's really too early to say, but the numbers are, for turnover, the turnover numbers for 2020, fiscal year 2026 are in line with 2025. Retirement's up year to date, well, to date.
And I think I saw that applications were actually stronger.
Applications are very strong, and we've been having, like, since the beginning of the year in December, we've been it seems like since the pandemic, like just record numbers. And I think the job market is definitely, it's softened up, it's definitely opened up, and it's felt like we're getting more applicants for a job opening, and just many new applicants than we were seeing before. Yeah, so we're encouraged by that as well. And there's a lot of speculation as to why, but we don't have any particular data on that. But I think the state of Vermont's a fantastic place to work, and they have great benefits, and they have pretty good pay. So if anyone's watching this on YouTube, we're open, and we've got a lot of jobs, and we're hiring. So go ahead and apply. Where was I? Okay, so talent acquisition. There's some stats there, and then this is we have a leave management unit that tracks employees requests for family medical cases. So those have to be kind of documented. And so that's a tracking mechanism, so we can just make sure that we're staying within the states and the federal family medical leave laws. So that's like us in a nutshell. I guess what I want to say as well, some of the work, like the recruitment work, the wellness work, is highly visible. A lot of the work we do is behind the scenes. We're kind of a lot of the back office of state government. For example, like the payroll, you may be either your mailbox yesterday or very soon are going to be getting W-2s. People think that that's magic. It's not magic to make that happen. There's a lot of work that goes in behind the scenes. It was compounded this year by some changes in the federal tax law that happened, and the One Big Beautiful Bill Act that happened kind of last minute. Usually we have more time to plan for those, and you know, our system vendor provides system updates, but we're like waiting for we get quarterly tax updates, but what's going to be in the tax updates? What can we use? What can we not? So that's all like sometimes even a scramble at the end of the year.
So your W-2s are going out.
The W-2s were mailed out. I received mine yesterday in the post office. So, and I'm in Burlington. So those folks who live maybe in a more rural area can expect to see those sometime, I would say, next couple months.
Depending,
right.
Excellent.
Yeah. Has collective bargaining agreement been ratified yet? I should know this.
There are, so we bargain with the Vermont Troopers Association, and we're still bargaining with them. We have the VSEA, we bargain with the non-management bargaining unit, the supervisory bargaining unit, as well as the corrections bargaining unit. We are not currently bargaining in corrections for the corrections at this moment. There was an election about
which.
which you need to go with, so that's on hiatus, but we have settled with the non-management and the supervisory,
Which is the main.
which are biggest. Well, corrections. Ooh, I think corrections is bigger than supervisory, but the non-management is the big one.
And they're voting now or what?
They voted,
They did,
they ratified.
they did right.
From what I understand, both of those have ratified.
I was sad to see Bennington Battle Day go away.
Um,
It's still there, but we just don't get enough.
but it is a
They don't-
trade, so the benefit there is so,
I just liked it because it was a very Vermonty holiday.
people did like the Bennington Battle Day holiday, but, we have, we, in the last bargaining cycle, the troopers as well as the corrections bargaining unit swapped out Bennington Battle Day for, Indigenous Peoples' Day and Juneteenth. And so in this sort of cycle, the other, two bargaining units did also. So everybody will be on the same holiday schedule, which I think is easier operationally across state government. And we do have very generous leave plans, so those employees who do want to celebrate Bennington Battle Day, hopefully they will be able to put in for that and be able to take that day off. Because it is a nice day off in the summer, absolutely. Especially those employees down in the,
Right, and then
in that quadrant.
they take it personal.
Um,
Do you have questions about that?
Nope, I've just been looking at the ups and downs and thinking about, I've got other questions.
Okay, you could ask them if you want, to, or you could ruminate upon them.
So one of them is, and I think I am still digesting how some of this works, but I'm seeing that one of the, if I'm interpreting this correctly, downs is in vacancy savings or vacancy turnover savings.
so the vacancy turn, that's always a down. It's kind of like a
Yes.
credit to, so if you look in the, yeah, it's just,
So my question is not about that one,
okay.
but then the one below that, other personal services, and that's down. And I'm just wondering what that means. I think I'm digesting what
So-
other personal services.
So that's in the, if you're looking at page 7, are you on page 7? What page are you on?
Yes, page 17.
Page 17, so you have the column you were asking about was in the internal service funds, and then over to the right, I think the internal department transfer.
Yes.
That,
Yep.
the negative $210,000.
Mhm.
So that is a transfer between departments, so we
Okay.
get money in. One of those positions is from is different from last year. We created a chief communications officer position.
Okay.
So we're and I might not be explaining it right, so Harmony may have to jump in and help me, but that's money that I've transferred in for that position, as well as we have limited service positions, 2 limited service positions for the Workday project, and one of the positions is showing in that budget. How'd I do, Harmony? Is that right? Is that right?
Okay.
It's just a difference in how it's funded. So
Okay.
one went up, one went down, and they just happen to use different line items of both calls on personal services.
Got you. Okay. And so it's, maybe not being funded through this particular, exact idea at this point, but it's gonna, like, where else would it show up?
AOAs,
Anyways, so,
so it's funded by AOA.
Okay.
That position sits, well, the position sits there, but the position number actually sits with DHR, so they give them the functions so that they can have the
okay.
position.
Thank you.
Is your service fee that you're charging other people going up? Like, are we gonna see that in other people?
Yes, you see in everybody's budget, you see, we have 2 big internal service funds. One is the HR internal service fund, and that's mostly on our operating budget, which you'll see on page 17. Most of that is an internal service fund. And then we have the VTHR internal service fund, which is part of the vision fund. So the vision fund, that funds the VTHR, and it funds the vision system, so the accounting system. So that is also that also are line items that show up in other people's budgets.
Is that changing? Is since we're getting rid of vision switching?
Well, yeah, there will be,
I assume there's a lot of costs involved with
so
the,
there's a separate cost, there's separate money that was allocated for the project itself. So the funds in the vision fund right now, and Holly, maybe you will want to add into what I'm saying, but. So the project funds right now are funded separately, but once we
is it
turn the
within you
system
or is it
on,
like an EDS?
it's. Go ahead, I'm gonna just let Holly talk.
Holly for Financial Services Division. So for the workday appropriation, there's a one-time appropriation in AOA, and then there's another appropriation within ADS. And so we're spending down the AOA appropriation first. So there are two appropriations.
That does affect HR's insurance service fund, what they're gonna have to charge folks to recoup some of that. No.
So the billing module the billing for that has not been developed yet, but we that vision fund is meant for an ERP, you know, because that system will handle financial piece as well as all the HR, similar to what BTHR is doing. So there will be an ERP billing module that's similar to what's being done today for BTHR.
Other questions? Did you want to walk through or just ask questions coming on ups and downs?
We don't have to go through all of it, but if there's anything else you want to bring our attention to, or you think kind of something that,
Yeah, the really only
And,
things different this year from last year are the limited service positions, the two that we have for the workday project that are being funded through that agency, that AOA, the RPV project appropriation. So that's the biggest difference, I would say. And that's kind of an upstream in our head count. But otherwise, it's our regular operating costs. And our big projects are already funded through one-time funds that have already been allocated.
I have a question on the exempt employees, because since I have a lot of state workers in my district, I get a lot of questions from state workers about the difference between classified pay, which goes through this whole classification system, which we're doing, and then what the exempt pay, and then what the I don't know if there's, I think of it like exempt and then the appointees, and I know that in the statute, the appointees are laid out there. I don't know if you even know why we put that in statute, like why is that not in just like session one or something? I don't know if you have any, I don't know if that matters, but I thought it was kind of weird that we put it in statute.
Employees who are in classified service, whether you're in the classified service or exempt from the classified service, are defined in statute. So the classified service folks have more job protections. They have like a constitutional job protection where they have a property interest in their job, where exempt employees are typically more like at-will employees. So you'll see the people who are exempt from the classified service are appointed authorities like me. Sometimes people like Holly might be, so there are some CFOs maybe that are exempt, but most of them are classified. So even the high level management employees are generally classified, but attorneys are exempt from classified service. You have the superintendents in the correctional facilities that are exempt from classified service. And many of those folks actually have separate pay plans where all of the folks that are appointees or appointees are they're still exempt, they're at will. It's more like an at-will employee versus those kind of protections of the classified service.
So they're going to be compensated for not having that job security in a way.
Yeah. So there's not, there's not the same type of job security that you would have and that you have in classified service that you might have in an exempt position. Interestingly, troopers are follow the classified service for many things, but are actually exempt from the classified service. So they don't have the part of being in the classified service is you have that labor board. You can, like, if you get terminated,
Right.
You can appeal to the labor board. If you're an exempt employee, you need to go to the court if you were going to sue your employer. But they classified employees have that right to go and get their case heard by the labor board. Whether you're a member of a collective bargaining agreement or not, you still have that ability to go to the labor board.
And it's all done in the pay act. Like that's where that discussion happens.
The money happens in the pay act, and then how much money is allocated for, and that's based typically on what we negotiate for the collective bargaining folks, and then we usually extend that to the exempt employees as well. And the vast majority of exempt employees, you can see that in the workforce report, but the biggest percentage there are the attorneys that work in the staff attorneys within the agency, the board and departments, or attorneys that work for the Attorney General's office.
I think that's been an issue that's come up, is that the executive branch go thinking with that, or the exempt get that same percentage increase as the classified into the negotiation. But since they're at such higher salaries, bigger dollar number, and then over years, the gap between the two. So I don't know if that's why I was asking about if the classification system is going to look at that as overtime.
So that's, and that is more of the compensation system, and interestingly, so the corrections bargaining unit, I think it was last time around, negotiated a new pay chart. So their pay chart where, the regular classified pay plans, you get steps, which increases your salary. So the first 6 years, it's a step every year, and then it's a step every 2 years, and then at the end, it's a step every 3 years. So it takes you about 25 and a half years, 24 and a half years, in the range of 25 years to get to the actual top pay, where the corrections department, the corrections bargaining unit condense that, so you get a step every year. But why I brought that up was when they negotiated that new pay plan, the second year of that plan, the pay increase is not a percentage increase. It was a flat dollar amount increase, where what we've negotiated with the other bargaining units over the years, and that's more typical, is a percentage increase, which does, the higher paid employees, whether get higher pay. So it can make that spread over time a lot wider. Which is.
Thank you. That wasn't a budget question for your budget, but it was something.
I want to say one other thing about exempt and classified employees. A lot of folks that aren't in the public sector talk about exempt, and that's a different thing, because they're talking about exempt from the Fair Labor Standards Act. So that's determined how employees get overtime, and are determined to get overtime just nationally and in Vermont. So if you're talking about exempt employees just in general with a regular business, they don't have any idea what we're talking about when you say exempt and classified, because they're talking about exempt from overtime rules in the federal government, which is different.
But we still have the same overtime rules.
Well, ours we've negotiated. We do have to follow the state and federal overtime rules, but through our collective bargaining agreements, we're generally more generous than what is required. So there might be somebody under the Fair Labor Standards Act that, no, there might be somebody that would be exempt from like the overtime, the time and a half, paying for overtime under the Fair Labor Standards Act, yet through our collective bargaining agreement, they get time and a half for overtime anyway, even though we're not required to as an employer by law, but we are required to because we've negotiated it in our collective bargaining agreements. Which makes implementing new payroll software very complicated.
Yeah, right, because they sell it to you based on the national law. Okay, well, thanks for your time.
All right.
Pretty straightforward on the budget. Appreciate it. Thank you.
Thank you. Good to see y'all.
Yeah.